Welcome to Relief Medical Group and our 4-course system. I'm Ed Cremata and I'm the Nursing and Rehabilitation Director at Relief Medical Group. Thanks for listening to this requested information regarding our individualized exercise programs. I'm going to give you the 4 components of the program and tell you what makes it sort of unique for you, and we'll start with aerobic capacity. Every exercise program should include aerobic capacity, which actually means endurance. We want to make sure that we exercise you to a point where you don't fatigue and you don't get tired too early. A lot of low back problems, for example, happen when the back muscles get tired at the end of the day, and oftentimes when people work overtime, they have more injuries because of this tiring effect. So we want to make sure that aerobic capacity is one thing that we incorporate in our program. Second part of our program is flexibility. We want to make sure that you're flexible where you should be flexible. Lack of flexibility will predispose you to injury. For example, if the back of your legs and your hips are really tight, every time you bend forward, they stop too early, and you end up using your back too much for bending over and for twisting. The third part of our program has to do with strengthening. We want to be sure that the muscles are strong where they should be strong to protect the spine or to protect any area that we're giving you an exercise program for, and we want to be sure that they're well balanced. The next part of our program is proprioceptive. This is a part that's ignored a lot, and proprioception essentially just means balance and coordination. So this is why we do things like use an exercise ball or have you stand on one foot to stabilize the ankle. This is the only thing that fires those particular muscles that predispose you to injury when you're doing normal activities or sport activities. So we want to make sure that proprioception is also part of an exercise program. So we will analyze your specific needs and get you flexible where you need to be flexible, get your aerobic capacities increased where they need to be increased. We need to get your strength up and, of course, your proprioception, and that will be designed for you. That's part of our Feel Better program. That helps you get corrected and stabilized, and it also helps you stay that way. The other thing that's sort of unique about our exercise program we don't see a lot is we like to teach you exercises where you use your body weight. And there's very few muscles in the body that you can't exercise very specifically using your body weight. The beauty about that is you don't have to buy any expensive equipment. It doesn't matter whether it's raining or not raining. You can do it inside or you can do it outside as you wish. And as long as you have your body with you, you can do exercises for your arms, for your abdomen, for your back. You don't need any special equipment. So that's one of the things that we pride ourselves in, is try to figure out how we can do it without you spending a bunch of money. We know the risk of buying a bunch of expensive equipment that sits around, and sometimes we don't always use it like we should use it. Within our rehabilitation program, it also helps some with our weight loss programs and helps you stay healthy. The evidence for exercise goes way beyond being strong and not injuring yourself. It's actually been shown to help prevent some cancers and be protective against heart disease and multiple other things. So if you have any questions about anything that we talked about with this exercise program, feel free to contact us. My personal cell phone number, if you have any questions specifically for me, is 510-913-1366, or you can call the office to make an appointment at 510-796-2225. Thanks for listening.